My name is Tim Ria here at the Digital Health Summer Summit. We host Digital Health Live, and we have Dr. Aenor Sawyer, who's the Associate Director of the Center for Digital Health Innovation at University California, San Francisco. Did I get that?
You got that right. Center for Digital Health Innovation at University California, San Francisco.
So I think I saw you last at the mHealth Summit or CES, but I keep on seeing you, and we have good chats on the side. What is your background so everybody knows where you're coming from?
I'm an orthopedist at UCSF, but I'm involved in device and digital health innovation, and I lead the digital health track in our accelerator there called Catalyst, and I'm also Strategic Relations Associate Director at the Center for Digital Health Innovation.
What drives you? Where do you get your passion from? I'm just teasing a little bit there. Try to make it fun. So we have a number of really cool panels that are about launching new innovations. And your panel was the art of the medical deal. Who was there? What was hot?
It was a really interesting session because there were two different models about medical centers, large medical centers that have innovation centers and partner with outside startups so that we can bridge health and technology. And one model was Cedars-Sinai's model, and then the UCSF model. Both academic medical centers, interestingly, one a private nonprofit, which is Cedars, they have a different model than we do in that they actually have a very large investment fund, and I think you'll probably hear about that in another take, but it was interesting to hear about the different ways we're approaching this. The idea is that we want outside startups and outside technologies to engage with us, and we want to help them in several ways. They usually come to us looking for one of five things: either a domain expertise, help with study design, actually doing a pilot if they need a pilot. Sometimes they want to have us as a paying customer, and finally, occasionally they want us in a co-development model, which we're also happy to engage in. So we try to triage what their needs are when they come to us. Our idea is that we have constant conversation with inside and outside innovators so that we can get clinical input early and often and help to get more effective solutions. So we're open to any of those arrangements, and I think truly we want to be viewed as someone who has an open door, not that it's hard to get into. Traditionally, it's been challenging for the outside groups to get in and get pilots or get information, but with the CDHI, we've tried to create this oasis of agility, so we're hoping we can make the process better. We're on a learning curve about how to do this, just like the startup world is on a learning curve about digital health. So we've started to put checklists and processes in place. We know that when we engage with an outside entity, we need certain things. We need NDAs, we need BAAs, we need IRBs, we need a security privacy check. So we now have more process-oriented systems to engage, and I think hopefully we can move more quickly and facilitate.
That seems like a trend here of really digital health and healthcare companies acting and trying to act more like fast-moving tech startups and cloud computing or mobile or other areas.
Yeah, so I just want to point out that we have a couple of obligations. One is, of course, we want to be responsive, and we want to get to more effective healthcare solutions. We need to improve the world of healthcare. But we also have an obligation to be advocates for our patients. And so sometimes it may feel like we're moving slow or we're resistant, but keep in mind it is our number one priority to do the very best thing for our patients. And sometimes that means we can't just do try and fail like you might in the technology world.
Very interesting. So what's your ask? What are you looking to get out of the conference here and for our audience out there that can help with your innovation center?
Well, I think the most important thing for us is partnering and building relationships in the different disciplines that show up to conferences like this, because there's always the potential for hybrid vigor. There's always the challenge of sometimes polarized views on things like free the data versus HIPAA violations and the responsibility of protecting patient data. But there's always a way to find alignment in the middle, and that's where the hybrid vigor comes.
Okay. Anything else that you thought was really hot or interesting on the panel?
out of our discussion, I thought that it was really interesting to hear the Cedar-Sinai model. And I think what's happened for us in our discussion preparing for the panel is I think we're going to end up partnering, because it's almost a hand-in-glove model where they're able to do funding and they're looking for specific technologies that fill their white spaces. In addition, we're building technologies very quickly on the front lines and partnering with others for integrated solutions. And we would benefit from more resources for those technologies and also the ability to transition them up and out of the university more easily. So I think we'll be complementary partners.
Good. That's good. So, well, how do people connect up with you?
The easiest way is to just go online and look for CDHI at UCSF or Center for Digital Health Innovation at UCSF, and it's the first thing that pops up.
It's always good to see you, Aenor, and thanks for being on the show. Good to see you
Tim.
again.
Appreciate it.
Okay.